if you're just ready to go on Medicare and you're looking at Medicare.gov and you're trying to find your drug plan on your own, you're like, how hard can it be, right? The government makes a Medicare website open. All the drug plans are there. I can just put in my zip code and find a plan and pick it. And I don't need the help of anybody, someone like us, our family, the MedicareFamily.com. I'll just do it on my own. Well, let me pull the curtain back a little bit from that. First of all, Medicare.gov, this is going to be shocking, is not always up to date. So when you'll look there and you're like, oh, this is the cheapest, you can't trust that. What we do as professionals is that we look at that, we look at the government's website, and then we'll go to Aetna's site or Cigna's site or Humana's site to verify it, because a lot of times the government is not up to date. So that's the first thing. But then the second thing is you're going to just say, well, I'll take the cheapest one. And there are a lot of plans that are very low. Some even have no monthly cost. And you're like, I don't know really how they do that, but I see it right there on the government's website. It's $0 a month or 50 cents or $1 or something very, very inexpensive. So let me tell you how they do that. First of all, there are many moving parts in a drug plan. Just one of them is the monthly cost. There'll also be a deductible, and every plan treats that differently. Some say the deductible is on all drugs. You got to pay this amount before we pay anything. Other ones say you only have to pay the deductible on the expensive drugs, your higher cost drugs. So the plans that are very, very, very cheap, typically they cover less of the expensive drugs. And I have to speak in broad generalities because I'm not looking at a specific plan. I would have to do that based on your zip code and your drugs. But if you're a healthy person, you don't take any drugs, or I have a lot of people, they just take a few drugs, but they're very cheap and they get them with GoodRx or Meijer or King Supers, and they don't use their insurance card. They just want a Part D drug plan, so they're in the system in case they do get sick, and they want to avoid that penalty. Okay, so let's look at the formulary. A formulary, I like to call that like a recipe. That's the ingredients that Part D drug plan covers. So this is not a formulary. A formulary is all the drugs that drug plan covers. And typically, again, generalization, the more expensive the monthly cost, the bigger list of drugs that company will cover. And you don't see that when you're healthy, right? Because you don't care, because you're not using it. But insurance is for the what if. So if you are taking drugs, we're going to put all your drugs into the system, research it, and see which plan comes up with the lowest price. That's pretty clear cut, right? But if you're not taking drugs, it's okay. It's okay to get one that's 50 cents, $1, very, very cheap, $10, $6. It's okay. But if you do get sick, you need to know that your expensive drugs might not be covered with your insurance. And that's okay. Insurance is a risk. We're all gambling. I just want you to understand how they can do that. So a plan that has a lower monthly cost typically has a higher deductible and covers fewer drugs, offers fewer drugs, and as you can guess, fewer of the really expensive drugs. So the government requires every drug company to offer a certain amount of drugs in each category, but they might not cover your insulin. They might not cover your blood thinner. And that's where you're going to have to just tough it out until the next annual election period, which is every year from October to December. And then next year you call us and you say, hey, last year I wasn't on any drugs. The year before I wasn't on any drugs, but now I'm on one. I had a client, she is 91. She took her first drug last year at 90. Now, the drug is Eliquis, which was $500 a month. So she was kind of shocked, having taken no medications, no prescription medications her whole life. She was in for a shocker. That's what we shop every year. Those prices change. What your plan covers change. What the drug companies charge, the government intervention, it changes every year. That's why we're very busy searching drug plans that last quarter of the year. Let's go back. If you need an appointment, you can book it on our website, themedicarefamily.com. Right there, the little yellow box. We're licensed in all 50 states. You don't pay for our services. So why go it alone? We can help you. You don't have to pay for our advice. Let's go back to the slide on the formularies. This shows you tier 1, tier 2, tier 3, and specialty. And that is the framework the government builds for their Medicare Part D. So people ask me all the time, is that the same with Aetna as it is with Cigna, yeah, the government requires this. But each company will have different generic drugs they offer that are tier 1, and they'll charge you different prices. Some might give their generic drugs at no cost. Some might have $3, $7, $8. It's all different, and it changes annually. The tier 2 is going to be your preferred brand name prescription drugs. They're going to be medium copays. Your tier 3 are going to be your expensive ones. And by expensive, it could be you pay 20% of the cost of the drug. Or it could be you pay $70, $80, $90 a month for the drug. It varies by all the companies. And like I said, your drugs might not be covered by this company at all. The worst scenario is when I have this company covers 5 of your drugs and this company covers the other 2. Neither one of them covers all 7. Then we have to try to figure out the math here and figure out what's the best way to go. So probably clear as mud, but I want you to understand that just because a drug plan is more expensive or less expensive, the premium alone is only one indicator on what plan you should choose. You want to look at the deductible, how it pertains to the drugs you take. And then you want to look at the drugs you take and what the copays are for them, what your total expected cost for the year is. That whole thing they call the donut hole that the Biden administration says went away, but we all know is really there if we don't call it a donut hole. That's the same. That's the same for all drug plans. You're not going to get a plan without it. That's the structure of Part D that the government requires. So there's not a plan without that. If you have more questions about your drug coverage, you can always email us, hello@themedicarefamily.com. Or, like I said, if you need to enroll in a drug plan or you need to switch and see if you can get a more advantageous drug plan, you can book your own appointment on our website, themedicarefamily.com. We're licensed in all 50 states, and you never pay for our services. If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment if you have a specific question. Always feel free to call us or email us at the Medicare Family.